So I am here in Anaheim, California for a plant-based healthcare nutrition conference. This is my second year attending. I went last year and this is my second year. So I am taking you guys along for the ride. I am running a little bit late. Today is the welcome dinner, which started at 6 and it is it's 6:24. So I think they're just kind of mixing and mingling now before everyone gets seated to eat. So I wanted to quickly pop on here and show you guys what I'm wearing. I have this dress. I'm gonna scoot back. I don't remember where I got this from. That's not important, but I'm wearing this dress. Simple, and I have flats on. I do have heels, but because I'm running late, I'm not gonna do the chore of trying to get that unpacked. So this is my outfit. So yes, I will be taking you guys along for the ride, and just to let you guys know that there is a shift happening in healthcare. There are a lot of highlights of importance being made to looking at healthcare from a holistic standpoint, and also paying attention to the things that we put inside our bodies, the things that we put on top of our skin, the things that we consume, the amount of community and involvement that we have, and so many other things. So I will be vlogging with you guys. It's my first time vlogging, so I'm excited. So let's get started. So hopefully you guys can hear me okay. I forgot to bring my mic, but I'm gonna do the best that I can. I just wrapped up the welcome dinner and there was one presentation and it was already so inspiring. There was also a luminary award that was given to a pioneer in transforming healthcare based off of the things that we eat. It was a man by the name of Dr. Furman. So I definitely want to look more into him and his work. He wrote a book called Eat to Live, which, if I remember correctly, oh my gosh, there was a book that my dad talked about that kind of sparked his fascination with food and nutrition. And so I don't know if it was that book. I have to see when it came out. Yeah, that'll be interesting. I'm gonna actually ask my mom if she remembers the book, and if she does, I will link it here on the screen. But yes, today has been super inspirational and just the welcome dinner. I know tomorrow the presentations and the speakers are going to be amazing. So my nerdy brain loves when we can piece together like the anatomy, the physiology, the cellular level of things, the healthcare side of things, the scientific side of things, with just the simplicity of plants, the simplicity of hope and how that changes us, how it affects different parts of our brain. So I am in complete I want to say nerd mode, but I'm like, does it have to be nerdy? Is that the label that I want to use? I'm gonna find a way to reframe that. So right now I am getting ready to take off my makeup, get into my PJs and relax and get ready for tomorrow. There is an app for the conference, and some of the people on there created a group for people who wanted to get up early in the morning and walk before the conference starts. So I'm hoping that I will get up. I think they're starting to walk at 6 a.m. so we'll see. If not, I will try to find some time to at least go to the fitness center here and at least get some steps in. I definitely don't want to be sedentary, especially sitting all day in a conference. So we will see what tomorrow holds, and I will bring you guys along for the ride. Alrighty, I am back in my room. It is 7 something in the morning, about 7:20 in the morning. I just finished a walk with a group. I think there was maybe 6 or 7 of us that got up and went for a walk this morning. I got in 4,481 steps. So starting the day off with movement. They did have breakfast already open. I think breakfast opens at 6 o'clock. So I had some oatmeal with some fruit and some walnuts and cinnamon, and then they had a Southwest tofu scramble, so that was provided for us. If I didn't mention it already, the plant-based healthcare conference provides breakfast, lunch, and dinner to us as part of our conference fee, and so that was what breakfast was today. I do know at lunch, I think Beyond Meat has reformulated their ingredients to include, like, take out things like coconut oil and include avocado oil. So I believe they are sponsoring lunch. I talked to one of the reps yesterday at the welcome dinner. So I think we're having Beyond Meat, their new version, crumbles. I think he said it was going to be either like tacos or like burrito bowls or something like that. So I'll get footage of that. Right now, I am about to shower and get dressed for day one of the conference. It starts at 8 a.m. I'll probably be a little bit late, but yeah, I'm looking forward to it. I have my sweater to keep me warm because these conferences always are a little bit cold. Actually, my suit has a jacket, so I won't need my sweater. So I'll show you guys what I'm wearing. I finished moving my body already. I'm dressed. I did a little light makeup, and I will show you guys what I'm wearing in just a second. I am excited to see what the day has for us. I'm excited to talk to some of the vendors that I've seen in the lobby, so come along for the ride. I have the conference book here, and so today's topics will be men's and women's health and hormones, medication management with plant-based nutrition, autoimmune disease, the year in plants 2024. So this is about the latest science reinforces the plant-based lifestyle, clinical pearls from a career in plant-based nutrition. Ooh, that's Dr. Joel Furman, who was the recipient of the Luminary Award yesterday. So I'm really excited for that. So yeah, I'm looking forward to today. I am going to show you guys what I have on. So it's a navy blue pantsuit with a matching top. I got this, oh my gosh, years ago. I want to say it was from JCPenney's, or I think it was JCPenney's. I was browsing through on a lunch break and saw it. It was on sale. It was cute. I like the navy blue. So yeah, I like it because it's elastic in the waist. I love the little detailing here. It kind of stopped. Let me see if I can show you. It stops here and then continues to go. The pants have zippers at the ankles, so this is super cute, very comfortable. I just have on a white shirt underneath, and then my shoes. I'm wearing some little comfortable shoes, heels from Naturalizer. I bought these. Well, I think I was traveling somewhere and I bought these, but yeah, super comfortable. They can last me all day because the heel is not that big. And then I have my conference badge here. So I know my lighting is a little bit off, but I have just wrapped up the first official day, even though it's day 2 of the Plantrition Project conference, and today has been awesome. I got to talk to a lot of really interesting people, and I have just enjoyed myself. I am looking forward to tomorrow, which is the last full day, although Monday they do have a few sessions in the morning. So yeah, I think the thing that I would like to share the most from day 1, I guess like key takeaways would be, number 1, raw, green, cruciferous vegetables are top tier. So incorporating more of that into your diet has massive health benefits. So you're looking at things like raw kale, raw broccoli, and those sorts of things. So for dinner, they had some raw broccoli, and I'm like, just because of all of the information, I added a little bit to my plate. I'm typically not a huge fan of raw foods in large quantities, but it is something that I may do like a health challenge for next year. So we'll see. Another takeaway, I think sharing our stories has so much impact. I was talking to this older Asian geriatric physician, and I was telling her, I was just telling her about, we talked about a lot of different things, but I was telling her how when I'm locked in as far as like being committed to what I eat, what I put into my body, I will still go out with friends and say they want to go get, I don't know, tacos and margaritas. I'll still go for the community building aspect, the socialization of it. But I told her, you know, I am not afraid at all, as long as it's allowed by the establishment. I will bring my own food. Now, I'm not talking about like Tupperware, like with food in it, but like I'll bring apple slices, or I'll bring carrots, or I'll bring something that I can snack on easily, so that I'm still hanging out, but I'm still staying true to like what my commitment to myself is. And she was like, that story almost feels like it gives me permission to do the same. And she's like, that's so courageous. And I was kind of like mind blown, because I would have never thought of it from that lens. I didn't think it was an example of me being courageous or me giving someone else permission. I just felt like, oh, okay, well, I say I want to eat healthy, so I have to make changes in how I go about doing certain things. But you never know how your story, just your normal things that you don't even think a second, you don't give a second thought to, can really impact how somebody else sees their behaviors and what they can do. So I thought that was really, really amazing to see. I was so grateful that she shared that with me, because I would have never thought that. And so it has inspired me and just continued to open my eyes to what's normal for me is not necessarily normal for everybody else. I think for a long time I've thought, there's already all this information out there. What am I bringing that's new to the table? But I think just sharing my story, everyone sharing their story, there is benefit to it. It allows people to widen their perspectives, to widen their mindsets in ways that they may not have even known that they needed. So that is part of the reason why I keep showing up here on YouTube. This is my platform to really encourage all of us, myself included, to become healthier together, because I do think the community aspect of it increases our chances for success and for sticking with things consistently over a long period of time. I am over the short-term 30-day challenge, but then you go back to what you're doing. I want to make small, consistent, long-lasting changes. And so I think by me just living out my life, trying to do that and incorporating that, I'll find like-minded people, and then also start to build a community, which is ultimately the purpose. So I am feeling really motivated. I'm feeling energized. And I clearly have a smile on my face. I am about to unwind, take a nice shower, do some reading, and get ready for tomorrow. Good morning and welcome to day 3 of the conference. I am just finished getting ready. I was gonna change up my hair and like maybe put the part on this side, but I decided to just leave it as it is. I'm kind of liking the middle part. So it's this chartreuse green color. I like it because this has a bow in the front. I feel like that's a nice little feminine detail. So I like that. So yeah, a little pop of color, a little pizzazz for the day. So I'm getting ready to go down and get my matcha latte, and then listen to the first round of speakers. They start really early, so I'm gonna head out. Let's go. Alrighty, day 3 is coming to an end. Just finished dinner and heading back into the elevator because some of the attendees and I are going for a walk before we call it a night. And so yeah, we are practicing what we preach. So hello, this is the last day of the conference. I also loved waking up in the hotel each morning, so I wanted to savor this morning. Today is definitely more of a casual look because I'm only going to be here for another 2 hours and then I'm getting on the road. So I wanted to be comfortable. I wanted to be in something that I could transition and go and pick up my son in. So this is what I ended up going with. So this is like a utility jumpsuit situation in navy blue. I got it when I was frolicking in Laguna Beach. It has shoulder pads to give it a little structure, has some cinching at the waist, and then yeah, it's just super comfortable. I put it on with my sneakers that I've been wearing this trip. I had an amazing evening and I'm hoping for a really great 2 speakers today. The first one has just started, so I am heading down now. Alrighty, and just like that, I am leaving the conference feeling very excited. You know how you get that high when you are like fully recharged, you're around like-minded individuals, you are ready to conquer the world. That is how I am feeling after this conference. And so I think it's been amazing to kind of recharge and refuel me for the work that I feel called and aligned to do, that I find purposeful. And so yeah, let me get back home. Alrighty, I have made it back home. I am mic'd up, so the audio quality should be improved. But I'm going to do a quick recap on some of the key takeaways that I've had. So I wrote down a couple little things here so I wouldn't miss out on anything. The first thing that I have been inspired to do, I was inspired last time. I don't know, I feel like as I continue on this path of purpose and alignment with healthcare and true preventative care, I really do feel like I want to get some type of certification in plant-based nutrition, lifestyle medicine, and so that is something that I will be looking into. So after I do research and vet out different programs and see which one aligns most with me, my goal for 2025 is to get certified. So I'm excited about that. Another thing that I've been inspired to do for next year, 2025, I love how it's September of 2024 and I'm already having a roadmap for 2025, so that feels nice. Although, trust me, I know life is going to life and do its thing, so these are general plans, general guidelines that I'm going to try to get accomplished next year, all things considered. But regardless, the second thing that I've been inspired to do is to not only attend the Plantrition Project conference again next year in 2025, but also I want to attend the American College of Lifestyle Medicine conference in 2025. I think it'd be a great adjunct conference to go to. So I'm really excited about that. I'm going to make plans for it, put it in my calendar, find out when the dates are, what the location is, so I can plan around it with not only my work, but also with my son's schedule, just to make sure that everything flows smoothly so that I can attend both. There's also another conference called the HELP conference that I think is going to be amazing. I believe it's in Florida next year. I don't know if I will have time for 3 conferences next year, so just in being realistic, the 2 that I am going to prioritize are the healthcare conference put on by ACLM, the American College of Lifestyle Medicine, and also the Plantrition Project conference next year. And the third thing that I have been inspired to do after this conference is to, and I don't know if I did this already or not. I have to go back and check. I don't think that I did. I want to sign up and become a subscribed member of a journal subscription, specifically the International Journal of Disease Reversal and Prevention. I have been a huge fan of Dr. Kim Williams for some time, and I know that he's spearheading that and heavily involved in it. So I want to go ahead and get a subscription to that so I can stay up to date on the latest, greatest information out there on the market. Something I was reminded of, I think sometimes, we live our own lives in this bubble and we forget to take into consideration sometimes other people's lives, their lifestyles, the challenges and the barriers that they face when it comes to true health. And Dr. Stoll, who is amazing, I'll insert a picture of him and I here. So he reminded us that for a lot of people, specifically here in the United States, true healthcare, going from where they currently are with poor health to true healthcare, is like swimming upstream against the current. And that is very difficult. Sometimes I think we like to oversimplify and really make it seem like, oh, just do this. But we forget that there are many factors outside of eating clean and moving your body that come with reducing things like obesity. It's not as simple in real life as that. And so it was nice to be reminded of that. It was nice to kind of get another boost of awareness with that, because a lot of our patients are facing a lot of different challenges, and so we need to look at things holistically. Although we don't like to think of it in this way, an example is that was given at the conference is that when somebody is an alcoholic, say they're addicted to alcohol, we don't tell them that, oh yeah, it's going to be easy, just stop drinking. We know that it's not that easy. We know that it's not that simple. And so in that same breath, the same way that people who are used to the standard American diet, it is not as simple as just saying, just stop eating it, just stop buying it. There are a lot of different factors that we have to take into consideration. And so I think it starts with listening to people's stories, hearing about where they are currently, and finding out ways to make healthier choices to get, number one, it's like they're going down the wrong path. We want to stop them from going down the wrong path. We want to help them turn around, and we want to help them start going back in the right direction. So it's not an overnight process. It is truly a marathon, which is really in alignment with what I am trying to do here on my platform. Literally, the premise of things for me is I want us to get healthier together when it comes to our mind, our body, our soul, and our community. Something that was really amazing to see. I mean, these are experts in their field when it comes to cardiology, electrophysiology. We had an ophthalmologist there. We had a psychiatrist there. We had endocrinologists there. We had pediatricians. No matter what the ailment is, it doesn't matter if we're talking about end-stage cardiovascular disease, if we're talking about the worst cases of type 2 diabetes, if we're talking about autoimmune diseases like lupus, they all have similar foundations for prevention, reversal, and cure, and it's all rooted in plant-based nutrition. A plant-forward diet really does go a long way, and it's so amazing. If you believe in a higher power, a higher being, if you believe in God, I do believe that He has created this world with such intention, with such design, that of course the foods that we eat are supposed to be healing to us. And so it's so amazing to see that by just incorporating a plant-forward diet, to getting a real good understanding on the foundation of what that really looks like and what that entails, it helps every part of the body. It helps the heart. It helps our eyes. It helps our brains. It helps our digestive systems. It helps our skin. It literally helps our moods. That is one thing that the psychiatrist went up and talked about. There is a relationship between the foods that we eat and how we feel. The rise of anxiety and depression and ADHD and all of these things is not coincidental. So it is something that we really need to just slow down and take a look at. And the crazy part about it is the evidence-based research is there. It's not like it doesn't exist. And I'm talking about double-blind clinical trials that have been done time and time and time again for years. However, as a healthcare professional, we never are taught about these things. So literally, when people go to see their specialist, when you go to see a specialist for your diabetes, for your hypothyroidism, for your chronic kidney disease, for your hypertension, your high blood pressure, a lot of these specialists, a lot of the primary care doctors are not even educated on these things. And it's so amazing to see a lot of them that are becoming more familiar with the research and being more exposed to the research, coming on stages saying how not only it affected their life and how they practice medicine in their respective fields, but how it is really such a shame and a disservice that they do not get this information in medical school, in nursing school, in whatever fields that they're in. So exposure is key. And so I do help that by creating content here on this platform in many different ways, by sharing information that there are things like this that exist, that I can help to just shed some light and some awareness that there is a shift happening. It's slow. There are lots of challenges and lots of barriers, but there are so many passionate and driven people that are on the forefronts and on the front lines, really, really fighting and advocating for a healthier community at large. Dr. Goldner got up and spoke, and she mentioned that, she tells her patients, that are on all of these medications, yeah, you may live until, say you're 65, 75, 85. Do you want to just be alive, or do you want to be well during that time? Do you want to be 65, but everything hurts? You're taking lots of meds. You're in and out of the hospital, in and out of the doctor's offices. You can't travel. You can't spend time with your family. You feel like a burden. Or do you want to be 65, 75, full of vitality? Do you want to be there to help raise, your grandchildren, your loved ones? Do you want to travel? Do you want to live life feeling well? That is the difference. Yes, the medications are there, but how many people do you know? How many people do you know who are on several medications, but they still don't feel well? It's not like they're full of vitality and youth. They're on the medications. They're doing what their doctors have prescribed for them, and they still do not feel well. Yes, maybe they're not in the hospital all the time, but they're still not in optimal health. That is the difference that we're trying to make. It's so crazy that all of these healthcare experts and professionals with rigorous years of training are presenting case studies on how literally, so Dr. Baxter Montgomery, huge fan, has had a case study that he presented talking about how he had a patient who was end-stage cardiovascular disease. Electrophysiology would not touch him in the hospital. They're like, he literally needs to go on, the patient needs to go on hospice. There's nothing we can do. Another specialist who tried to get involved, another consultant, was like, they're already saying that this candidate, that he's not a good candidate. We need to put him on hospice, let this patient just die here in the hospital. There's nothing else that we can do. He literally went in, focused on they call it hypernourishment via a plant-based diet, along with some other measures. And when you hear about the turnaround, when you see the numbers start to improve, it's literally mind-blowing. Oh man, there are healthcare providers and specialists that are here on the front lines doing amazing work, literally saving people's lives. And I'm so grateful for them and their contributions. And I hope that I can do my part to contribute to the movement of real healthcare and not sick care. Because honestly, we are taught to manage chronic diseases. We are not taught to reverse them. We're not taught to cure them. We are simply managing them. And a lot of times we're just managing the symptoms. We're not getting to the root cause. We're not providing real education. How many people, and if you've ever been to the doctor's office, if you've ever sat with a specialist, how much time do you even have with them? Some people say the doctor never even sat down, didn't shake my hand. They came in, they were there for 5 minutes and they left. This is something that you hear time and time again. We cannot create change in those situations with those restrictions. There has to be a change if we're going to get people collectively healthier. And then lastly, there was a statement that sitting is the new smoking, and that is just a way to emphasize the harmful effects of having a sedentary lifestyle. So sedentary, someone who is not active, who does not move around a lot. We saw a lot of this during the pandemic because we were afraid to go out. We were being told and instructed to shelter in place, and so we spent lots of time watching TV, sitting down on our laptops, not getting much time outdoors. But now that the pandemic is not what it was, it's not at its height anymore, we had the opportunity to go out. So it's really about not just promoting a plant-forward lifestyle. Like I said, we look at things holistically. How are we managing our stress levels? That plays a huge role. What do our social connections look like? What does our sense of community look like? That is really important too. It is not just a one-size-fits-all type of prescription. It really has to be individually tailored to each and every person. But we have to move our bodies. We need to go out for walks. We need to get sunshine. We need to eat healthier. We need to hydrate ourselves. There's so much information, and I think a lot of times people get overwhelmed. Like, where do I start? I really feel like at some point I'm going to do some type of like health coaching, lifestyle coaching, something of the nature, because I really do believe that people need guidance. And as much as sometimes people create, I think it's an amazing thing, people create these guidelines. What I've seen in practice with patients myself, what I've heard a lot of is it's not individually tailored. And I know that impact can be slower that way because you're working with people one-on-one. And I know that there's a lot of room to try to create opportunities to reach masses of people. So there's a balance between the two that I want to find. And yeah, I'm super amped up, you guys. I'm full of energy and lots of ideas for what I even want my YouTube platform to kind of look like, what I would like to kind of implement on Instagram. So yeah, I appreciate you guys for sticking around and watching this video. God willing, I will be at the plant-based healthcare conference next year. So if you want to join, you do not have to be a healthcare provider to attend. A lot of it is geared towards healthcare providers. So there's a lot of medical terminology and things that are used, but you do not have to be a healthcare provider. As far as like a practitioner, there were occupational therapists there. There were registered dietitians there. So any adjunct specialist, I would definitely encourage you to go. And even if you're somebody that just wants to be in the room, I would highly encourage you to go. So yeah, my goal is to hopefully get another healthcare provider to join me next year. I'm just really excited about it. And I think that spreading awareness that it even exists, so that we can plant those seeds. Literally, the tagline of the conference is planting seeds of change. Sometimes we are just planting the seeds, and hoping to water them throughout the year so that we can harvest some really beautiful outcomes in the future. If you are interested in learning more about anything that I talked about, feel free to send me an email. I'll link it here on the screen. Also, as you already know, you can leave me a comment down in the description box. I will always do my best to get to you. So far, I think I've responded to everyone. And so I do take pride in that, but I know that it's because right now my channel and my platform is on the smaller side. And so it gives me the flexibility to do that. So if you want to connect, if you want to talk, definitely let me know. I am here. I look forward to engaging with you all. If you found this content inspiring, motivational, or just something you want to be alongside on the journey for, feel free to subscribe here to my channel. It really does go a long way to help my channel grow here on YouTube. As always, if you like this content, feel free to give it a thumbs up. That helps to spread it here on YouTube so that other people can find it. And last but not least, if you have not connected with me over on Instagram, I will link my page here. Feel free to do that. If you want to collaborate on any projects or efforts, definitely let me know. I'd be open to talking about them and seeing if we are in alignment. So until the next video, you guys,